Hello, ladies and gents. This is chapter 17, part 2. So at this point of the chapter, we have discussed the functions of blood. We have discussed erythrocytes, red blood cells. So let's go ahead and take a look at our leukocytes, our white blood cells now. Alright, so our white blood cells are going to be mainly known for the fact that they will contribute to our immune system. And what we need to talk about is the fact that you have different variations of your white blood cell, and each of them will have a very specific function. So let's take a look at some of the general structures and functional characteristics. So leukocytes, also known as white blood cells, remember they are the only formed elements that are considered a complete cell, and that is because from beginning to end, they will hold on to their nuclei as well as all of their other organelles. They are the least in quantity ways, the least common formed element. It's less than 1% of your total blood volume. And it turns out that our leukocytes actually do not like to stay in our bloodstream. And the reason for that is very simple. They actually like to stay within the tissues and some of your lymphatic organs, because that is how they can monitor your body for any type of abnormality, such as bacterial or viral or parasitic infections. In fact, the only reason that you'll see an elevated or a high number of leukocytes in your bloodstream is when your immune system is actively fighting off or just finished fighting off any type of pathogen. So that's one of the reasons why when you go over to the doctor's office and you're not feeling well and they order blood work, if they see that you have an elevated level of white blood cells, they know that you're either fighting something off or you're recently fought something off. And then what they'll do then is they'll take a look at which specific white blood cell is elevated to come up with a treatment plan. And I'll talk to you more about what I mean with that. Usually what we see happening is if there is any type of immune system activation of the white blood cells will leave the tissue that they're in, and they will go ahead and hop into the capillaries to go over to the site of injury. And when they get over to that site of injury, they will hold on, or they'll start interacting with the walls of the capillaries. We call that diaphysis, meaning that they'll squeeze very closely to looking for any opening, and that will they'll squeeze their way out of the capillaries into the tissue that's been injured. And when they do so, they do what we call amboid movement, meaning that they're actually attracted to the site of injury, that they're responding by chemotaxis, and that usually has to do with the fact that injured tissues will release chemical messengers and inflammatory reagents that will recruit over the white blood cell over to the site of injury. Now, leukocytosis takes a look at an abnormal number of white blood cells. And like I said to you before, the number one reason that you would have higher levels than normal, it usually means that you're responding to any type of infection or any type of alert to the immune system itself. Now, when you look at your white blood cells, it turns out that from a physical standpoint, we can divide them into two categories. You can have what we call the granulocytes and the agranulocytes. And these two categories are established by the fact that some white blood cells will have lysosomes, little granules floating around their cytoplasm that will be visibly stained when we do a right stain. And when you're able to see these granules, we will then go ahead and classify it as a granulocyte. That's where the name comes from the fact that you can see these little granules. And we're going to notice that anytime you look at the name of these white blood cells that are granulocytes, it's always going to end in a phil. So these are going to be your neutrophils, your basophils, and your eosinophils. So anytime you see the white blood cells name end with a phil, you're looking at a granulocyte. Now, some of the white blood cells will not have these lysosomes granules, which means that they won't stain and their cytoplasm will be more of a clear, opaque color. Now, if you see that, then we're looking at an agranulocyte. A means lacking. So agranulocytes means that it doesn't have these granules, and these will be your lymphocytes and your monocytes. Now, don't worry if you haven't jotted down the names of the 5 white blood cells that I just mentioned. You're actually going to see them over and over again from here on out. So let's go ahead and switch over to the next slide, and let's take a look at the names properly. Okay, so here is a little percentage breakdown of the formed elements. It is not drawn to scale, very important to point out. We've discussed our red blood cells, and now we're going to take a look at our leukocytes, and the platelets will be part 3 of our lecture, so a little bit patience on that. Now notice how for our leukocytes, we see that we can do what we call a differential white blood cell count, which means that we want to figure out what percentage of them is actually composed of the 5 different white blood cells. So come on over to your right-hand side, and you can see right here, you have your granulocytes. Remember, these are the ones that when we stain them, will have small little granules floating around in their cytoplasm, and these are the ones that always end with "phil," and we see that we have the neutrophil. That's the most common one, the eosinophil, and the basophil. And the basophil is the least common of the white blood cells. The agranulocytes are the ones that will not have the granules floating around in their cytoplasm, and those are going to be 2 of them. So you have your lymphocytes and your monocytes. So you have 5 different white blood cells that you have to familiarize yourself with. The phils, neutrophils, eosinophils, and basophils, and those fall as a granulocyte, are classified as a granulocyte. And then the agranulocytes are going to be your lymphocytes and your monocytes. Now there's an easy way for you to remember the most to the least abundant white blood cell, and that is to remember this saying. So look up right here. It says, never let monkeys eat bananas. All right, I'm not taking credit for this mnemonic. It's been around for a really long time. But basically, the first letter of each word will go ahead and correspond with the letter of the specific name of the white blood cell. So you can see the neutrophil is the most common, followed by the lymphocyte. Then we have our monocyte, our eosinophil, and our basophil. Now for your exam, please don't worry about memorizing these percentages. That's something you can easily look up. I'm not worried about that. But I do want you to definitely remember this little saying right here, because then that way I can ask you a question like which one is the most common, which one is the least common, and I can do it for overall, or I could say which one is the most common granulocyte, which one is the least common agranulocyte, okay? So you want to definitely know from most to least abundant, but I don't need you to memorize the percentages. I'm not going to ask you on your exam, 50% of your white blood cells are composed of what? We're not going to worry about it that way, because keep in mind that these percentages will also be altered depending on things like body size, whether we're looking at a male or a female patient. So go ahead and just keep that sentence in mind. Never let monkeys eat bananas. Don't worry about memorizing the posted numbers in parentheses. Now here is a visual aid of our granulocytes. So this is from a histology standpoint. And go ahead and take a look at your first 3. And I put little red arrows so you can see that inside of the cytoplasm of the cell, you see small little dots. These little dots are granules. So this means that if you see the little granules, we're looking at our granulocytes and we're looking at our phils. Now the neutrophil will tend to have more of a pale reddish purple like granule floating around. And in case you're wondering what is this darker structure, this is the nucleus. Because remember, leukocytes hold on to their nucleus from beginning to end. So if you see that the granules are like palish, reddish, palish, purplish, you're looking at a neutrophil. If you see that the granules are more of a darker red color, you're looking at a eosinophil. And if you see that the granules are very large and they're dark purple, then you are looking at a basophil. Now, this is what we're going to do for our class, because I know a lot of you are taking the lab along with the lecture. When we do our homework, you will get pictures of your white blood cells where you will have to identify them based on what you're seeing. There are no pictures on our exam, so instead what we're going to do is, for exam purposes, I will not ask you what color are the granules. I will not ask you what does their nucleus look like. Instead, what we're going to do is we're going to focus on what exactly is the function of the neutrophil. What exactly is the function of the eosinophil? What exactly is the function of the basophils? So keep that in mind, okay? So when you study for your lab, when you study for your homework, you'll come across some morphology questions, some anatomy questions. What's the color of the granules? What's the color of the nucleus or the shape of the nucleus? But when it comes for exam time, you just want to be able to know the names of the white blood cells. You want to be able to tell me if it's a granulocyte or an agranulocyte. Most abundant, least abundant, and in a little bit we're going to add the function to it as well. Now, the granulocytes that do not have the granules floating around in their cytoplasm, they tend to have clear cytoplasm. Those are going to be our agranulocytes, and as you can see, you have your lymphocyte here. That's a little smaller one. Usually it has a very minimum amount of cytoplasm. It almost looks like a little halo that surrounds the nucleus. And then the really large one that has like a kidney-shaped nucleus, that one's going to be the monocyte. All right, so now that we've seen what they look like, let's go ahead and assign a function to each of them. All right, so let's start off with our granulocytes. So remember, these are our phils, and it turns out that all of them tend to have some phagocytotic property. Phagocytosis, you might recall, is bulk eating and bulk drinking. So that means if it comes across any type of pathogen, it will be able to engulf it or consume it and thereby destroy it. Now, I mentioned to you this before, the granulocytes get their name because when you do the right stain, it's a specific staining technique, it's able to interact with the lysosomes, these little granules floating around, and thereby able to stain them, you know, either that pale purple, dark purple, or reddish color for each of the particular granulocytes. All right, so let's start off with the neutrophil. Now, we've already learned about the neutrophil that it's a granulocyte. We know that it's the most numerous, right? And then now we need to have a function to it. So for its function, you're going to know that it has antimicrobial properties. And that basically means that it will go ahead and find any type of bacterial infection that you have, and it will try to go ahead and defeat it. So your neutrophils are actually called bacteria slayers because anytime you have a bacterial infection, their numbers will increase. And the reason why they're so successful is because they're able to do this process called a respiratory burst. And the respiratory burst is usually seen when the different proteins of the neutrophil, including their densin protein, will start to interact with the foreign bacteria, and it will actually start poking holes through the membrane of the bacteria, and it will release lysogenic enzymes so that the bacteria cell will literally dissolve from the inside out, and it will create almost like these oxidizing substances like hydrogen peroxide and bleach. And as it's doing so, it also has a phagocytotic property. So I added this little illustration for those of us who are trying to remember phagocytosis, our little bulk eating. You can see our little white blood cell is here in blue, and you can see that as it approaches the pathogen, it will actually engulf it, and it will go ahead and destroy it through the use of different lysozymes. And then once it's destroyed, the little particles are released back out, and you have no longer any need to worry about your pathogen. Now, for exam purposes, please know that the neutrophil is specific for bacterial infection. And here they are in case you want to try to remember what they look like. Our eosinophils, now those are going to be specific for parasitic infection. So if you have any type of exposure to a parasitic worm, like maybe a tapeworm, If you go over to the doctor and you say, you know, I'm not feeling well, something's going on, if they do a differential white blood cell count on you, they would see that your eosinophils are abnormally high. And that would then give an indication that you're fighting off a parasitic infection. So they can go ahead and figure out the course of treatment. I do also want to mention that your eosinophils tend to be elevated anytime you have an allergy, as well as if you have asthmatic attacks. Usually those numbers will increase as well. But overall, their main function is to fight off parasitic infections. Excuse me. Your basophils, now these are the least abundant. Your basophils with their very dark purple granules, those are best known for being able to produce large quantities of histamine. Now, those of us who are not familiar with histamine, histamine is an inflammatory chemical that your body will often tend to secrete anytime it wants to go ahead and indicate that there is some type of distress or injury within the body. It is a vasodilator, so it will open up your blood vessels, so it will increase the blood flow, making it easier for your white blood cells to hop into the blood flow and get over to the site of injury. In fact, people who suffer from allergies usually have abnormally high amounts of histamine that are floating around. So they'll go and they'll get an antihistamine treatment, and that will lower this inflammatory chemical down in its quantity. Usually with basophils, we also see that they'll increase in cases such as exposure to chickenpox, sinusitis when you have an inflammation in the sinus, as well as uncontrolled diabetes will give you high levels of basophils. So for exam purposes, you want to know that your basophils are going to produce high amounts of histamine. And you also want to know that they'll increase in situations like chickenpox exposure, sinusitis, and diabetes. If you've ever heard of mast cells, these are cells that you find throughout the body that are best known for histamine production. They function very similar to your basophils, or I should say the basophils function very similar to the mast cells, meaning that both of them are able to produce histamine. All right, so just to review, we had our neutrophils for our bacteria, we had our eosinophils for our parasitic infections, and then we had our basophils that are going to come into play for histamine, chickenpox, sinusitis, and diabetes. All right. Now remember, we want to focus on the function, not as much on the morphology, because the morphology we're going to handle in our lab for those of us who are in lab, but we're also going to handle it in our homework assignment. There are no pictures on the exam, so I won't give you a random picture and say, what is this? Instead, I will ask you more about its function. All right, so let's go ahead, and now that we tackled the phils, let's take a look at our agranulocytes. Our agranulocytes are going to be the ones that lack the cytoplasmic granules. We have two options here. We have our lymphocyte, which is the smaller one, and we have our huge one, which is the monocyte. So let's see what they're going to be contributing over to our immune system. All right, so here are all 5 of them together, just for those of us who are a little bit more visual. And we're going to go ahead and focus on the agranulocytes now. By the way, all these little pink reddish cells that you see surrounding them, those are your erythrocyte, your red blood cells. So notice how your white blood cell, in addition to the fact that it holds onto the nucleus, it's also significantly larger than a red blood cell. Just a little FYI. Okay, so here we come back. So for our agranulocytes, let's start looking at our lymphocytes. And the lymphocytes, these are very important cells because it turns out that they are going to allow us to have what we call adaptive immunity, meaning very specialized immunity. Your lymphocytes will go ahead and either migrate into the lymphoid tissue, like areas like your lymph nodes or your spleen, and they will become very specialized. In fact, when we take a look at the lymphocytes, what we see is that they'll either specialize into your T lymphocytes or your B lymphocytes. And they get their name because during the course of the development, the T lymphocytes will go over to the thymus, where they will become immunocompetent, meaning that they'll learn the difference between self and foreign antigen, which cells belong to you and which one don't, and they'll become very specialized in attacking any type of virus-infected cells or a cancer and a tumor cell. Your B lymphocytes get their name because in the bone marrow, B is for bone marrow, they will also become immunocompetent, but these cells, when they respond, they will actually produce our antibodies. So your T cells and your B cells are very important to your immune system, and I just want to kind of introduce it into this chapter because we're going to go ahead and in a few months, I guess, we'll have a whole chapter on our immune system, and we'll talk about how you can just go from just a regular stem cell over to a very specialized T cell and a B cell. So you'll come across these again. I also want to mention, and I wrote this in red, is that the lymphocytes are also able to produce a third cell. This is called a natural killer cell. A natural killer cell is part of our innate immunity, meaning it's part of the immunity that you're born with. All of us have the same type of natural killer cells, and these natural killer cells are very important because they'll roam around the body looking for any type of foreign antigen, and when they come across it, they will destroy it. So it's one of the first lines of defense that we have against both bacterial and viral infections. So I wrote it in red because the book doesn't really mention it at this point, but it's definitely also a lymphocyte. So I know you're going, wait, what do I need to know for your exam? So for the lymphocytes, you want to know that it's going to develop into the T cells, the B cells, and the natural killer cells, and that these three cells are going to be important for our immune system. And then our last agranulocyte is going to be our monocyte. And let's just take a quick second and take a look at this video. As you can see, this big cell right here, that is the monocyte, and it's making its way over to the red blood cells. And I didn't speak fast enough. Here you go. It's going to go again. Now, the little piece that's vibrating, that's a little bacteria. And what the monocytes do is they scavenge for anything that doesn't belong. And when they find it, they will go ahead and do phagocytosis. So let's watch the video. It's going to chase it, it's going to chase it, it's going to grab it, and when it finds it, it's going to eat it right there. That's phagocytosis that you're seeing right over there. And it's able to do that because the monocytes will eventually develop into macrophages. They're these large phagocytotic cells, and they basically scavenge the body for things like viruses, bacterial infections, parasites, chronic infections, and they basically try to destroy everything through phagocytosis. It is a fantastic system. Look at that. I could watch this video over and over again. All right, so those are our 5 red blood cells. So we have our granulocytes, which are the fills, and then we have our agranulocytes, which are going to be your lymphocytes and your monocytes. The lymphocytes are going to be the T cells, the B cells, and the natural killer cells. And then the monocytes are going to develop into macrophages, which are these large phagocytotic cells that basically go after everything that doesn't belong in the body. Now, of course, we also have to explore exactly how do we make our white blood cells. So this is going to be called leukopoiesis. Leukopoiesis is the production of our white blood cells. And I don't think it should surprise you to hear that since we have 5 different cells, it's going to be a little bit more complicated than our erythropoiesis when we were looking at our red blood cells. So let's walk our way through it, okay? So first things first, remember with any of the formed elements, it will always start with our hemopoietic stem cell tissue that we can find in the red bone marrow. One of the differences here, though, is that our hormonal signal is going to be different to turn our stem cell into a committed cell. In fact, instead of relying on EPO, which will allow us to produce our red blood cells. If we want to make our white blood cells, we're going to have to look at things like interleukins and colony stimulating factors. These are all different chemical messengers that are being released, and they will go ahead and communicate with our hematopoietic stem cell in the red bone marrow, and they will allow for committed cells to start. Now, please take a look at the bottom of your PowerPoint, and it says that all leukocytes come from our hemocytoblast stem cell. That's our hematopoietic stem cell that you find in the red bone marrow. However, we see that within the stem cell, it will very early on develop into two different pathways. You will have your lymphoid stem cells, and you'll have your myeloid stem cells. Now, your lymphoid stem cells will give rise to our lymphocytes. Okay, so L with L. The myeloid stem cells will go ahead and give rise to all the other elements, meaning your other granulocytes, as well as your monocytes. So we're going to see that our hematopoietic stem cell is going to divide into the lymphoid stem cell and the myeloid stem cell. And from there on, we're going to see that the lymphoid will eventually give us our lymphocytes, and the myeloid stem cell will eventually give us all our granulocytes as well as the monocytes. Now, there is a visual aid that goes along with this, so let's go ahead and click over to the next slide so that we can kind of see the steps and we can see what the names are that we need to know for our exam. All right, so give me a second, my apologies. I thought the illustration was coming up, but it's going to come up a little bit down the road, so please bear with me. Here are some of the names of the cells that we're going to encounter. Now, from our hematopoietic stem cell, remember we're either making our granulocytes or our agranulocytes. So this one right here says that if you're interested in making your granulocytes, then what we see happening is that there are basically 5 different cells that you're going to encounter along the way. So once you have your hematopoietic stem cell, you're going to go ahead and have your myeloid stem cells that divide, and we're going to see that the first developmental cell is going to be called a myeloblast. And these are the cells that will arise from your myeloid stem cell line. Then you're going to go ahead and have your promyelocytes that will develop from your myeloblast, and they get their name because they're going to start accumulating the lysosomes. Remember, the lysosomes are the initial precursor to your granules, and when we see that the granules are fully formed, we then go ahead and change the name of the cell to a myelocyte. So we had a pro, and now we have the myelocyte. So that's the one that's going to accumulate the granules. And then we're going to have to change the morphology of the nuclei because it's going to have more of a curvation to it. And if we see that happening, we call it a band cell. And last but not least, you will then get your mature granulocyte. And at that point, you have your different granules, you have the morphology of the nuclei fully established, and we see that they can go ahead and be stored in the bone marrow, or they can make their way over to their storage unit. And as you can see right there, 3 times more white blood cells are formed than red blood cells because the white blood cells have a shorter lifespan. And obviously, anytime they come across a microbe that they have to fight off, they tend to die off in huge numbers in their defense system. Now, what happens if I'm looking at an agranulocyte production? Well, you won't have to know all 5 names of the agranulocytes because it's going to slightly differ. And what we see happening is we have 2 agranulocytes. We have our monocyte, which is going to be derived from the myeloid cell line, the same cell line that we saw in our granulocytes. And the monocytes are going to go ahead and have their developmental name go from monoblast to promonocyte to monocyte. Okay? And they tend to live for several months. The lymphocytes, they are not going to use the myeloid cell line. Instead, they're going to use the lymphoid stem line. And that lymphoid stem line will go ahead and allow the lymphocytes to go ahead and subdivide into their T cells, their B cells, and not mentioned, but the natural killer cells. And these lymphocytes can go ahead and live hours to decades. And part of that is because a lot of them will be stored in the thymus and in the bone marrow, where they're just kind of sitting, waiting for any type of allergen or pathogen to attack the body and be notified of it. All right, here's my illustration that I was mentioning before. So let's work our way through it. Yeah, please don't get overwhelmed. I know there's a lot going on, but we can do this. So let's start on top. So remember, all stories start when it comes to our formed element with our hemopoietic stem cell line. So these are your hemocytoblasts. And as I mentioned to you before, we're going to see that the hemopoietic stem cells are going to subdivide into the myeloid stem cells and the lymphoid stem cells. And the lymphoid for L means that it's going to go ahead and give us our T and our B lymphocytes. So as you can see right here, it will go from stem cell to committed cell all the way down to its overall B cell and the T cell, B lymphocyte and T lymphocyte. And it does kind of show you how the B cells will further divide when they become active into their plasma cells, which are the antibodies, okay? And then the T cells will become effector T cells because they'll become immunocompetent. Either way, I'm getting a little ahead of myself. Please just know that if you see us going from a developmental aspect from hemopoietic stem cell to lymphoid stem cell, that you're looking at the development of your lymphocytes, so your T cells, your B cells, and your natural killer cells. The myeloid stem cells, so now we're back on the left-hand side, the myeloid stem cells are going to go ahead and give rise to all of your granulocytes as well as your monocytes. So you can see right here that the committed cells are going to be your myeloblast, remember B is for building, and your monoblast. So your myeloblast, as they start developing their lysosomes and their granules, they're going to go ahead and get their name changes. Remember, we talked about this about 2 slides down. Your promyelocytes, your myelocytes, and your band cells, because they're going to have the curvation of the nucleus. And as they transition from myeloblast to promyelocyte to myelocyte to band cell, we see that they'll eventually mature into all the phils. So you have your eosinophil, your basophil, and your neutrophil. Also, coming from the myeloid stem cell will be our monoblast. And our monoblast, that's our committed cell that will continue to develop into the promonocyte, and that will eventually give us our monocyte, and the monocyte will eventually mature into our macrophage, that large phagocytic cell that we were looking at on our little video. So take your time, take a look at the illustration. Please get comfortable with the fact that our hemopoietic stem cell will divide into the lymphoid stem cell, which will give rise to all the lymphocytes, so your T lymphocytes, your B lymphocytes, and your natural killer cells. And your myeloid stem cell will give rise to the myeloblast, which will become promyelocytes, myelocytes, and band cells, and eventually will give rise to all the granulocytes, eosinophils, basophils, and neutrophils. And then your myeloid stem cell line will also give rise to your monoblast, which will become a promonocyte, which will become a monocyte. And monocytes will develop into macrophages. Now, to finish off our discussion of white blood cells, let's talk about some disorders. And very similar to our erythrocytes, we can either have too many or we can have not enough. So if you have an overproduction of white blood cells, usually that's called leukocytosis, and that can just be a normal occurrence due to the fact that you are actively fighting off an infection, an allergy, or a disease, and your white blood cells, when they're in leukocytosis, so abnormally high, it is very important to often get a differential white blood cell count so that you know exactly which white blood cell is elevated, and therefore you can have the proper course of treatment. So remember, we talked about things like the neutrophil. If those numbers come up really high, you know you're fighting a bacterial infection. So depending on which white blood cell is high, it's very important to kind of figure out what its abnormality or what your immune system is facing. You can also have high white blood cell because of leukemias. Leukemia is when you have cancer in the red bone marrow that causes an abnormal amount of white blood cells to be produced. The problem is that the white blood cells will have a different morphology. They'll look completely different, and they'll also won't function as they normally would. So they don't give you any type of protection from the immune system. If you have an abnormally low amount of white blood cells, this is called leukopenia. This can put your health at risk because if you don't have enough white blood cells, you have an elevated risk of any type of infection. And this can be bacterial or viral. There are many different things that can cause leukopenia. As you can see on the PowerPoint, it says it can be drug-induced, especially if you look at things like anti-cancer drugs or glucocorticoids. Remember how we talked about in our previous chapter that if you're very stressed, your body will release high amounts of glucocorticoids, things like cortisol. This can have an anti-inflammatory effect, and it can actually lower your production of white blood cells. And if you do so, it puts you at a higher risk of an infection because, like I said, you are losing that defensive property that your body relies on. All right, so I think that's a nice place to kind of come to and halt for part number 2. In our last part of the chapter, part 3, we will go ahead and we'll explore our platelets. And then I also want to talk to you about something very important, which is blood typing. So we'll talk about what establishes blood typing and what that means for our antigen versus antibody production, and also what that means for things like blood transfusion. So I think it's another interesting lecture that you have to look forward to. All right, so let's end here. And as always, I want to remind you that if you have any questions, comments, or concerns, please do not be shy and do not hesitate. Send me an email or go ahead and post it in the discussion session. All right, everybody, talk soon.